Now, in terms of the drug development, we talked about one particular drug, CPI-610, which is the epigenetic modifier, like we were explaining. But there are other drugs that are very advanced and are being tested or about to be tested in phase 3 randomized studies. And your audience knows that phase 3 studies are randomized studies where you compare the new drug to old drug or something which would be considered standard therapy for approval purposes. So in myelofibrosis, apart from the excitement about the CPI-610, where the company recently announced that they do plan to do phase 3 randomized study in newly diagnosed patients never treated with the JAK inhibitor, where patients will be randomized between the JAK inhibitor ruxolitinib or combination of ruxolitinib and CPI-610. There are other phase 3 studies. So we have studies in a frontline setting, the same type of study that I just described, with another agent that is combined with ruxolitinib, which is called navitoclax. The combination of navitoclax and ruxolitinib has been presented 6 months ago at American Society of Hematology meeting, and we have an update coming up in a couple of days here as well. That's another exciting combination. Next, you have anemia drug. We haven't talked about anemia at all. Anemia is number 3, right? One of the 3 problems. Luspatercept is the drug that was recently approved for myelodysplastic syndrome, a cousin to myelofibrosis. There is an evidence of good response when you add luspatercept to ruxolitinib to improve the anemia. Remember, JAK inhibitors worsen the anemia. Phase 3 randomized study comparing ruxolitinib plus luspatercept to ruxolitinib alone will be conducted soon as well. And then you have a JAK inhibitors momelotinib. Phase 3 study is being done in ruxolitinib failures. This is after ruxolitinib. And the pacritinib, another JAK inhibitors in patients with low platelets below 50. And finally, there is also a plan announced about 10 days ago for another drug called imetelstat, which was studied after ruxolitinib in what's called the second-line setting, that possibly can improve the longevity of the patients after ruxolitinib. This is after ruxolitinib. I repeat this multiple times. This is where we don't have anything to offer. Imetelstat will be studied in comparison to best available therapy for ruxolitinib failures. So I follow these drugs very carefully so to know what's going to happen. Navitoclax, luspatercept, imetelstat, momelotinib, pacritinib, in addition to CPI-610.